Why set it apart like this, as opposed to really instead just talking about increasing surgical capacity within all health conditions and all of global health?
One of the most important things about surgery is that it is cross-cutting. It doesn't lend itself to a disease-specific group because it's a procedure, because it's a treatment as opposed to a disease. And we're focusing on scaling up surgery in that way because we really don't want to make the point that the world should focus on surgery instead of focusing on tuberculosis or instead of focusing on maternal health, but that the world should focus on surgery because we're not going to be able to achieve our maternal health goals if we don't actually scale up surgery in the entire hospital. We aren't going to be able to treat some really advanced forms of TB if we don't have surgical procedures. We're not going to be able to treat cancers, et cetera, et cetera. The list goes down. So surgical conditions aren't a separate disease entity at all. It's surgical treatment that is part of the health system that we're working on.
Surgery is fundamentally different from everything else. And there's a reason why we need to focus on it as a separate entry. And if you really, really narrow it down to a very, very focused set of interventions and show them that it's possible to provide that, then several things happen. First, you can't help but invest in the health system as a whole. So that's one of the things that happens. You can't help but make sure there's clean water, make sure there's sterility, that you train people. And getting that to fruition actually then shows the Minister of Health it's possible and shows the community that it's possible. But unless you're able to really step into that primary role and to reframe surgery as an integral part of primary care, then it's something that the Ministers of Health would just say, well, you know what, it's too hard. And in the 40 years will go by and nothing's going to happen.
Surgery has been viewed to be such this complex thing to do and such a hard thing to do, and it's because you literally have to bring the means of production of surgery to the individual patient, and so you have an entire ecosystem that you have to build up, which is true, but which is exactly the reason to be doing it. Because when we start doing that, when we start building up this ecosystem, we've built up the electricity, the water, the sterilization, the training, everything that we need to do in a hospital. So it is, in global health speak, it is the quintessential horizontal intervention because we've got to do everything to fix surgery.